You sleep 7 or 8 hours every night, and while you sleep, your knee is either recovering or getting worse. Most people over 40 are unknowingly destroying their knee cartilage every single night, not from exercise, not from diet, from the position they sleep in. Tonight, before you go to bed, I'm going to show you exactly what's happening inside your knee while you sleep, and the one change that takes 10 seconds and starts working the first night. Comment below, do you sleep on your side, your back, or your stomach? Subscribe. Next week, I'm covering the one food that accelerates knee cartilage breakdown faster than anything else. Here's what most people don't know about knee cartilage. It has no blood supply. None. Unlike muscle or bone, cartilage cannot receive nutrients through the bloodstream. The only way cartilage gets the nutrients it needs to survive and repair is through a process called diffusion. Nutrients from the joint fluid are literally squeezed into the cartilage, and waste products are squeezed out through mechanical compression and decompression. During the day, every time you walk, bend, or move your knee, you're pumping nutrients into the cartilage and pumping waste out. The cartilage acts like a sponge. Compress it, release it, nutrients flow in. This is why movement is so critical for joint health after 40. But here's what nobody talks about. The most important recovery window for cartilage isn't during the day, it's at night. When you're lying down and the knee is unloaded, joint fluid surrounds the cartilage completely. This is when the deepest nutrient diffusion happens. This is when the micro damage from the day's activity gets repaired. This is the window when your knee either recovers or doesn't. And the position your knee is in during those 7 or 8 hours determines everything. A 2018 study in the Journal of Orthopedic Research found that sustained knee compression during sleep, even low-level compression from body position, reduced cartilage nutrient diffusion by up to 40% compared to an unloaded neutral position. 40% reduction in nutrient delivery to your cartilage every single night for years. This is why knee cartilage after 40 degenerates faster in some people than others with identical activity levels, identical diets, identical body weight. The difference is what happens at night. So which sleep position is actually destroying your cartilage? The answer will surprise you, because it's not the position most people assume. Side sleeping is the most common sleep position in adults. About 60% of people sleep on their side, and if you have knee pain, side sleeping is almost certainly making it worse, in a very specific, very predictable way. Here's the mechanics. When you sleep on your side with your knees stacked directly on top of each other, which is the natural default position, the top knee presses down on the bottom knee. The IT band on the top leg is being stretched under gravity for the entire night. The medial collateral ligament on the bottom leg is being compressed, and most critically, both knees are bent at an angle that puts sustained low-level tension on the posterior capsule of the joint and compresses the medial compartment of the cartilage. After 40, when cartilage is already thinner and less resilient, this sustained compression during the critical recovery window means the cartilage on the inner surface of both knees is being slowly starved of nutrients every night. There's a second problem specific to side sleepers. When the knees are stacked with no support between them, the hip on the top side drops slightly toward the mattress. This creates a slight internal rotation of the femur, the same mechanical problem I described in the last video about glute medius weakness. The IT band tightens, the knee tracking shifts, and this position is sustained for 7 hours. I had a patient, Sandra, 49, a nurse from Seattle. She came to me with progressive right knee pain over 18 months. No injury, no change in activity. We went through everything, her diet, her exercise routine, her footwear. Then I asked her one question: which side do you sleep on? She always slept on her right side. Right knee on the bottom, compressed against the mattress for 7 hours every night. We changed one thing, we changed her sleep position. 6 weeks later, her knee pain had reduced by 60% without any other intervention. Same exercise routine, same diet, same body weight, just a different position at night. But side sleeping isn't the only problem. The position most people think is the safest, the one doctors recommend, has its own specific way of damaging the knee after 40, and it's even more common. Stay with me. Back sleeping is widely recommended by physicians. It keeps the spine neutral, reduces acid reflux, and distributes body weight evenly. Most doctors who have knee patients tell them to sleep on their back, and many people with knee pain put a pillow under their knees for comfort because it reduces the pain in the moment. Here's the problem. A pillow under the knee holds the knee in a slightly flexed position, typically 20 to 30 degrees of flexion, for the entire night. This feels comfortable because it takes tension off the inflamed structures. But sustained flexion does something specific to the posterior capsule of the knee joint. It keeps it shortened. Over weeks and months, this leads to a measurable loss of terminal knee extension, the ability to fully straighten the knee. Loss of terminal knee extension is one of the most under-recognized problems in adults with chronic knee pain. When you can't fully straighten your knee, the mechanics of walking change. The quadriceps works harder. The kneecap tracks abnormally. The fat pad gets compressed with every step. The symptoms that the pillow was supposed to help get worse over time. A 2020 study in physical therapy found that adults with chronic knee pain who regularly slept with a pillow under the knee showed measurable loss of knee extension range, on average 8 degrees, compared to those who slept without it. 8 degrees sounds small, but losing 8 degrees of terminal extension changes the entire biomechanics of the knee during walking. The pillow feels like it's helping. It's slowly making the underlying problem worse. And there's a third sleep position, the one almost nobody does. That is actually the best for knee recovery. I'll show you exactly what it is in a moment. But first, I need to tell you about what happens inside the knee in the first 90 minutes of sleep, because this changes everything about when and how you set up your sleep position. Sleep has stages. Most people know about deep sleep and REM sleep, but there's a specific window within the first 90 minutes of falling asleep that is uniquely important for joint recovery, and almost nobody knows about it. In the first 90 minutes of sleep, your body produces the highest concentration of growth hormone of the entire 24-hour cycle. Growth hormone is the primary signal your body uses to initiate tissue repair, including cartilage repair. It stimulates the production of collagen. It activates the cells responsible for cartilage maintenance called chondrocytes, and it reduces inflammatory cytokines in the joint. A 2019 study in the Journal of Clinical Endocrinology found that growth hormone release during the first 90 minutes of sleep was 3 to 5 times higher than at any other point in the day or night. This is your body's repair window. And if your knee is in a position that's compressing the medial cartilage or restricting joint fluid circulation during this window, you're blocking the repair process at the exact moment when it should be happening most actively. This means the position you fall asleep in, not just the position you end up in, is the most critical. You may shift positions during the night, but the first 90 minutes while you're in deep slow wave sleep and growth hormone is surging. That's when your knee position matters most. I had a second patient I want to tell you about. Michael, 53, an engineer from Denver, chronic bilateral knee pain for 2 years. He had tried everything: physical therapy, anti-inflammatories, knee sleeves. When I assessed his sleep habits, he was falling asleep watching TV on the couch with both knees bent at 90 degrees over the armrest, then moving to bed an hour later. He was spending his entire growth hormone window with his knees in sustained 90-degree flexion. We changed his routine. He moved to bed before falling asleep, set up the position I'm about to describe, and fell asleep in the correct position. 8 weeks later, his bilateral knee pain had reduced by 70%. Same physical therapy, same medication, just a different sleep setup. The position I'm about to show you takes 10 seconds to set up, and after everything I've just described, you'll understand exactly why it works. The optimal sleep position for knee recovery after 40 achieves 3 things simultaneously. It unloads the medial cartilage compartment. It maintains the knee in neutral or slight extension, not flexion, and it allows full joint fluid circulation during the growth hormone window. Here's the exact setup. If you're a back sleeper, remove the pillow from under your knees entirely. Instead, place a small rolled towel, about 3 to 4 inches in diameter, under each ankle. This elevates the heel slightly, allows the knee to fully extend, and slightly unloads the posterior capsule. The knee hangs in neutral extension. Joint fluid can circulate freely. No sustained compression on any cartilage surface. This is the position that maximizes cartilage nutrient diffusion during sleep. You're a side sleeper, and this is the most important change for most people. Place a firm pillow between your knees, not under them. The pillow between the knees does 3 things. It stops the top knee from compressing the bottom knee. It keeps the femur in neutral rotation, preventing the IT band from being tensioned under gravity all night, and it maintains the medial joint space on both knees, allowing cartilage to decompress and absorb fluid. The pillow needs to be firm enough to actually hold the knees apart, not a soft pillow that compresses to nothing. A firm memory foam pillow or a dedicated knee pillow works best. The knees should be approximately hip width apart when the pillow is in place. One additional recommendation, regardless of sleep position: keep the room cool, between 65 and 68 degrees Fahrenheit. A 2021 study in the European Journal of Applied Physiology found that cooler sleep environments increased slow-wave sleep duration by an average of 14%, which means more time in the deep sleep stage where growth hormone release peaks. More growth hormone during a properly positioned knee equals faster cartilage recovery. Start tonight. Rolled towel under the ankles if you sleep on your back. Firm pillow between the knees if you sleep on your side. Cool room. These 3 things, done consistently for 6 weeks, will change what happens inside your knee every single night. Your knee has a repair window every night, 7 or 8 hours, where cartilage either gets the nutrients it needs or gets compressed, starved, and slowly degraded. The position you've been sleeping in has been determining which one happens. Rolled towel under the ankles, firm pillow between the knees, cool room at 65 to 68 degrees. Tonight. If you want to know which specific food is accelerating knee cartilage breakdown faster than anything else after 40, and it's something most people eat every single day,